morning.
Good morning.
Good
Good
morning.
morning.
Welcome, everyone.
Morning.
Hello, all.
This is fantastic. I see some new names and faces. Hi, Dan. Hi, Julia. Hi,
Yes,
Jeff.
good morning.
Good morning.
Hi, Marie.
Hello. So excited to be here.
So
Double
excited.
whammy Jen Day.
Oh, yay. Is there another Jen event?
Yes, I have a LinkedIn live right after this.
Oh,
So
you do.
yeah, I
Well, why don't you plug it?
know.
What is it? What are you
It's
doing?
me, Zach McCurry and I are doing an event. So super excited about it.
You want to throw the link in the chat?
Holly, can you do that for me?
Yeah, absolutely.
Okay, thank you. All
Thank
right, well,
you.
so good to see everybody here.
Yes, love it. And I love to see that people have their cameras on. Hi, Steve. Hi,
Hello.
Carson.
Lucas.
Um, we're going to just jump in and get started. We have our very own Jen Marr here to present today her lifting up framework based on her new book that has been released. I'm going to read her bio and then I'm going to turn it over to Jen. Jen Marr is a speaker, founder, and CEO and author of Showing Up. She's utilized her 30 years of experience in business, leadership development, and the healthcare industry to research, develop, and offer solutions to our current mental health crisis. Jen's groundbreaking innovative work in mental health, crisis response, and social well-being brings a new perspective to a field currently dominated by self-care solutions and emotion-based training. She addresses the current empathy to action gap through what she calls the awkward zone. Jen is a top voice in leadership on LinkedIn and a member of the Forbes Business Council. Her movement is taking root in notable organizations including CVS Health, the U.S. Office of Personnel Management, the White House Leadership Development, the National Suicide Lifeline, Georgetown University, HCA Healthcare, Blue Cross and Blue Shield, KPMG, Northeastern University, U.S. Department of Labor, USAID, and the New York Office of Mental Health. And as she just shared with me before the call, also getting it into some school systems with some very excited future clients. So excited to hear what you have to say today, Jen. It's so important. And I always think, flourishing and connection in community, it's incomplete with all of that. And um, self-care isn't really the answer. So I'm excited to hear this and want to just reinforce that empathy is a skill that we all can develop and learn, which is what Jen is here to teach and train.
Well, thank you,
Turn it over to
Karen.
you,
It's
Jen.
so Thank you. Thank you so much. It's so great to be here. I've got a bunch of slides. I'm going to be doing more or less my more framework approach. This isn't a keynote approach. So I really kind of want to share with you some of the things we've dove into and how we're tackling that with our framework and skills. So I'm going to share my screen and just dive into this with you. I've got a bunch of slides to share. We'll see what we can get into today. But we are not at Summer Summit 2025. I am going to move on from that slide. Okay. My journey started at Sandy Hook Elementary. Prior to that, I was in business development. I was taking a career break, raising my three daughters. My husband was busy traveling all over the world, so I stayed home. But my business development background was always kicking in. And as I was there to support the Sandy Hook Elementary community after that terrible shooting, I continued to watch and pay attention to what was happening around their tragedy, around their lives, and really just listening every day to what was going on. Within 4 months of that, and one of the ways I was dealing with this tragedy is I was training for the Boston Marathon bombing or the Boston Marathon. Kind of gave it away there. I would run every day to try to deal with what was happening at Sandy Hook, and who would have thought that zero point 0.4 miles away from the finish line, bombs exploded. And so there I was within 4 months dealing with two very, very deep tragedies. And one of the things that I saw right away was how, as humans, we are not good at responding to people in hardship, and how there is this awkwardness that overtakes us. And we think we're good people. We think we're doing what's right, but it falls flat every single time. I would hear from every week when I was in Sandy Hook, teachers and staff, they would go into the supermarket and people would walk down the next aisle because they just didn't know what to say or do. So I saw immediately how those that are struggling suffer more, because people don't know how to support them. Yet, people that are supporting them feel like they're doing enough because they're good people. And I don't think it's the right time. And so during all of this, I started being asked to get research done. I've gone through so many research pilots now, really researching how can we teach people to care for one another? What is it that gets in the way? What is it that stops us? Because ultimately, we're good people. We all really are good people, but our actions are not getting to the people that hurt. As an example, in Sandy Hook, 75,000 teddy bears were sent to a town of 20,000 people. It's just, it doesn't work. It added an additional burden on a town. So many times, even if we think we're empathic and compassionate, the actions that we do fall flat. We might think we're doing well, but we're not getting through to the people. So as I've been on this journey and writing books, we just keep coming into this fact that the world is groaning. We are Everyone is struggling. And so as I started, researching this skill and doing it more from a peer-to-peer level, I wrote my first book, Showing Up, was much more of a peer-to-peer level. But as I would go out to this need to different organizations, people were like, well, leaders, we have to know what to do. We don't have the luxury of just the art of presence, just making sure we're good listeners and making sure we're doing good acts in the community. We have to know how to guide people through what they're going through. And so that really led to a lot of my research in this, as to the new book, Lifting Up, that we're going to talk about today. But as far as I see it, there are three major things going on out in our world today that are driving this shift. Obviously, technology and AI, there's so many talks about that, completely changing the way we communicate, we interact with each other. The generational divides, the generational differences, really a lot of because the technology that has been changing lives over the last few decades. And then every week we've got world national events, we've got divisive politics, we have all of these things that are entering the workplace. And so I think a lot of people understand this term. It's something I've been looking into for over a year. Is VUCA. Our world is very volatile, uncertain, complex, and ambiguous. And when our world is that way, people are that way. And when people are that way, organizations have to deal with the people dealing with the VUCA world. And so one of the things that we really started diving into are just the human behaviors in the workplace when these things take place. And over the last 7 years, we started to see these trends. We put these trends together, we'll call them the relational 80s. And give or take 15 points, every single organization we've worked with over the last 7 years have fallen within this bucket. 80%, I can tell when someone's struggling. Most people will consider themselves empathic. Most people will consider themselves compassionate. And they will say, I can see you when you struggle. Most people out there in leadership are good people. And so when you go at them and say you need to learn empathy, it doesn't work because they already consider themselves empathic. So yet, 80% of people in the workplace says no one sees me. So here we are. I can see you, but you know what? No one has any idea what I'm going through. No one has any clue what I'm dealing with. And then we ask them, do you let people know? No. I just suck it up, have to, I can gut through this by myself. I should be able to handle this by myself. I need to be resilient. So I don't share my challenges. But then we ask them, do you wish you could be more open? 80% yes. But then the last 80%, what, what is that? Like, I wasn't trained to do this. I show up as a leader. I'm not a psychologist. What the heck do I even do here? And so this is the relational 80s that we talk about, and it looks something like this. I can see you, but no one sees me. I feel so alone in this world. I don't have anyone to talk to. I don't have time to share it with anyone, and no one has time to share it with me. But hey, I'm going to show up at work. I'm going to smile. I'm going to mask anything I'm dealing with. All is well. But when I'm at home, I don't really have a support system. We have found that up to 40% of people in a workplace don't have a robust support system outside of work. So if they're coming into an organization already struggling with not a support system, as we're dealing with distributed work, people flying all over the place, you know, communities just not the same safety net that they used to be. We've got people walking in the door feeling very alone, needing to be supported. And so when I wrote the book, I collaborated with this organization called Ink Factory. And Ink Factory Studios, as you talk, they draw. And I threw this concept out to them and asked them how they would draw this. And look at this. Most people care, yet most feel unseen in their struggles. And I'd like to take a second and I'd love to see what people think. What do you see in this image? What do you see? Holly, can you chime in? I'm not able to see the chat. Or Karen, can you tell if anybody's putting their comments in? Because I can't unfortunately see the comments right now.
I'm not seeing comments.
Absolutely.
Oh yeah, there we go. Complete
Complete,
mismatch.
yeah, complete mismatch.
I see people missing the light of the face, two people who care but don't have the skill sets to help each other or come together, looking at their feet.
Mhm. There's so much here in this, and in the book, if we can dive into it a little more. But all of this then sets up the chasm in the workplace that we have, because we still are operating in many organizations under the old school leader. The old school leader says, leave it at the door, work is work, home is home, personal is personal, leave your emotions behind. We've all heard this. If you've got any more to share, put them in the chat, because there are a lot. It's a very transactional form of leadership, very much focused on output. And if someone's facing hardship, that goes to HR. That's not my job. But as we see, there's this ginormous elephant in the room that we can't just send people away when they're struggling and the leaders get off scot-free saying it's not my job, not my place. And so as we dive into this, and this was something even back 12 years ago when I started this journey, I noticed I would see every day students and families on their screens, to the point where, like, do we even remember what it was like not to have a screen in our hand? And I think what happens right now with our human behaviors and our social interaction and our social muscle is, if you envision life before we had screens, what would each of these people be doing in these pictures? They would be forced into silence, and they would be forced into some sort of awkward interaction, right? And we all know that we've formed our social muscle through a lot of awkward interactions. And you know what? There are no awkward interactions anymore, because what happens if it's awkward, we grab our screens, right? And I want to show you the day, or what I was starting to see. This is a crisis response room I worked in back about 10 years ago. And I want you to notice what is in nobody's hands here. They are not holding phones, except for that back guy in the left corner there. When someone is struggling, this is what they want. They want connection. And when someone's struggling, they're most open to it and they're most comfortable with it. They want to be around their friends. They just want to be. They want to be comfortable. And what was behind this picture? 20 counselors that nobody wanted to talk to. They want to be with each other. They just want to be. And so in these situations, we brought in golden retrievers. We let them just be there. These were students most impacted by death of two students that they loved. And they will not put phones in their hands. in a situation when they're struggling. And I think that's really important to understand as we are trying to lift up a generation that has been raised with screens in their hands. This problem is growing because of all of this. Our native digitals, as we will call them, we don't like to label generations, but anyone that was raised with a phone in their hand, we're going to call a native digital. They look differently in view of leadership. They don't want to be a leader. They're like, just give me a life. I've seen my parents go through all the craziness of working hard, but yet they're so socially underdeveloped because they're not having these awkward exchanges that are needed in order to build our social muscle. So leadership to them is somebody that's going to help them, guide them, and not just say, this is what you have to do your job, here are the 10 things we need to get done. These generations value relationships and psychological safety, but they're not quite sure what that looks like. And the old adage of fear of missing out has moved into fear of taking part. So when we have hybrid workforces and we've got people working home on their screens, they don't want to come in. It's too awkward. They don't know the people. They don't want to make small talk. There are all these different generational social skills that just aren't developed. And so that is really why I dove into this book. Our intent is good. Almost everyone in leadership has good intentions, but the impact is missing. And so as I dove into this, I'm sure a lot of you have heard this Dunning-Kruger effect, and I actually reached out to Dr. Dunning on this. And he actually did not initially create this. There's a whole great story about this in the book if you have it. But usually we have high confidence. And Dr. Dunning will say that one of the best examples of this is in how we think we're good people. Now, another great example of the Dunning-Kruger effect is that 93% of Americans will consider themselves in the top half of drivers, best ability of drivers. So 93% of Americans consider themselves a good driver, which is statistically impossible. The same is true about our own skills in interacting with others. And once we start understanding like how, oh my gosh, I'm not hitting the mark. I'm a good person, but people are feeling unseen. What is it that I'm doing? And that is what we're tackling here. So there's a real science behind it. We consider ourselves good people because we are, but our skills are lacking. And that's all this boils down to. So as we started diving into this, we all love ourselves a four chart diagram here. This has been underway. This is probably our core training, which is what we dive into the awkward zone. What is that gap? What is that chasm between our intent and our impact? And it really boils down to four buckets. And what we want to be able to do is develop this language so people can understand like, that's what I'm doing. And it's super simple. We are either overthinking or underthinking things. Or if we're in person, we're overdoing it or underdoing it. So the top two squares are just in our heads. They're just don't even go anywhere. And statistics will show that 80% of when we try, or 80% of the times that we try to support someone, we're going to fall flat because either we don't do something we think we should, we have good intentions, or what we do falls flat, as in the case of Sandy Hook, 75,000 people sending teddy bears. So let's start with the overthinker. The overthinkers, again, this is in our head. These are kind of like invisible barriers. The person that's struggling has no idea you're even thinking about them. So either you're overthinking it. Overthinking it is the doubter. The doubter is mostly driven by fear. Fear like, I don't know if it's the right time. I don't want to make it worse. I'm afraid if I say something, it's just, oh, I don't know. I'm afraid I'm not the right person to say something. I just am not sure. So the doubter is mostly fearful. The underthinker, think of a drip of water off a duck's back, full on deflection. Hey, that's not my job. I wasn't trained for that. Isn't that what HR is for? I got my own problems. I don't have time for this. I can't take that on. A lot of deflective behaviors in the workplace. So you can say, I'm a really good person and I care, and be a deflector. That's where the chasm starts, right? Now, let's say the bottom two that we're going to look at, this is when we're actually in front of the person. We're talking to the person. We're engaging with the person that's struggling. and they walk away saying, they have no clue what I'm going through. Either we would have tried to be the fixer, and we all know the fixer. The fixer is just, I'm going to jump in and solve this problem. And oh my gosh, I see what's all on your plate. Like, here, do this and do that. And have you tried this? And did you read this book? And you should talk to this person, and just da 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 da, without having had the chance for that person to really be able to be acknowledged and validated. So too many times we jump in and leave that person feeling unseen because we haven't taken the time to really see what it's like to be them. And the other one is we're with them, but you know what? Right in front of them, don't even bring it up. We're just going to focus on what's at work today. I know that person's going through a terrible time, but you know what? I don't have time. I don't want to bring that up. I'm not quite sure how that's going to be handled. So we avoid it right in front of their face. So this is the awkward zone that accounts for so much of this growing chasm. And these are all made up of hundreds of behaviors that can be assessed and brought to the attention of people. And let's be clear, this is a behavioral assessment. So we're all going to fall into any of these. It changes based on the season of life you're in. It changes based on the person you're interacting with, which is why we have to be able to understand these barriers on a whole so that whatever the situation is, we can say, I'm deflecting. Okay, what do I need to do? And that's really what our trainings are meant to go through. So really what this ultimately forms is what is connection with care. It is support. And so we call this supportive leadership. This is what my book is about, called Lifting Up. Showing up is just the basic human interaction skills for that broad, beautiful art of presence. Lifting up are the additional skills that a leader needs to guide someone forward. And why is it important for a leader to be supportive? MIT's got a great study out there talking about 10 things to get your culture right. And being a source of support is the leadership trait most closely associated with a highly rated culture. So what stops us then? What does this look like in organizations today? We like to talk about this as the barbell of care. And I want you to envision a barbell. On either end of it are two heavy weights, and we have a bar in the middle. So we work a lot with clinical care. Our EAPs have great access to therapy and counseling, and that's fantastic. It's very needed. It's very good. On the other side is a lot of self-care strategies. And under this, I would put EQ, because anything that we are doing within ourselves to do our inner work to make ourselves better, that is what I would call self-care. That inner work that's needed to make sure we are self-aware, that we are aware of things. Those two are all on the person that's struggling to initiate. So if that's all that we have people that are like, what the heck? I am going through this terrible time. Now I have to go to HR. I've got to understand what's in the EAP. I have to hire a coach. I have to hire a therapist. I have to figure out what to do. I need time to meditate. I need time to do this. It's all on me. Some of this costs a lot of money. Who's there supporting me? We can't put everything on the person that is struggling to figure it out on their own, which is why we like to say the part that we focus on, the most critical part of all, is the supportive care. It's where we live every day. It's that person that says, I got your back. You're not in this alone. And that's what every leader out there today should know how to do. It should be as black and white as any other thing in the handbook. They should know how to have this skill. It's not about emotion. It's not about driving deep into, emotional topics. It's a skill. So that's what we are diving into. So Oxford, going back to the barbell, did this fantastic research. I don't know if you all have seen it. They surveyed 46,000 workers, not a little survey, 233 organizations. And they looked at things like well-being apps, that self-care side. If we put it on the struggling individual, now go do mindfulness and go be resilient and take a stress management class, and here's your well-being app, and we as an organization are doing what we need to do. No evidence that it helped. None. Because what happens when you're dealing with all this stuff and you get these things and you just walk back into an environment that's not supportive to you, that your leader doesn't have time for you? That's where we're going. So there's a growing consensus that organizations have to change the workplace. It's not all on the person. And that's why when we build culture, it's why I love collaborating with Zach Mercurio, who I'm doing a LinkedIn Live later with. It all starts with mattering. It all starts with making sure people feel seen. Resilience, happiness, growth, that stuff's all great, but that's a byproduct of having a very strong culture. So mattering, respect, and dignity is that we know our people, they trust us, we understand what they need, and we are together with them enough that they know that we will guide them through their hardship. If we have that bottom level right, this is what I consider mattering. You're seen and valued. I consider dignity. You deserve honesty, not spin. And I consider respect is I trust you with the truth. Got a lot of people that don't take the time to do these things today. Once we have that bottom level done, then we can grow our community. Then we can have a sense of belonging. We can support and care for people much deeper. And you know what? If those two levels are in place, resilience and happiness is a byproduct of it. That's where we really find flourishing. So we like to think of it as a lot of little actions. When you give your time, when you give your attention, when you give your respect, when you're flexible, when you're affirming, when you're understanding, you take away all the things that are clogging our workplaces today. And we like to think of it as every single little action is a little deposit in that relational bank account. Super important to know what those actions are. So, what in fact then are those actions? Um, we have to also understand that there are factors at play why this problem is growing. I see my friend Marie Gill, who's just been such a great collaborator with me on a lot of stuff on this, but she will tell you how senior leaders are burning out. There's tremendous statistics on that. Middle managers are getting squeezed. We saw how the younger generation, they don't want to manage anymore. I dove into incivility and social anxiety in the book and the underdeveloped social skills. Where are workplaces heading with all of this, right? So we found that basically over the last years, all of this boils down to four things that happen in this VUCA world. Leaders not around, so there's a lack of availability, approachability, and relatability. That's number one. When your leaders aren't around, you get really bad communication. It's very siloed. It's just a whole bunch of, information being thrown at people, which is not communication. It's just an information dump. So nobody reads all their information. So it ends up no one told me about this, which then leads to complete lack of psychological safety. If I'm not communicated to well and then my leader's not around, I'm not comfortable speaking up. And if those three things happen, then I'm just overwhelmed. How can I get out of this? So in lifting up, we talk about the 5 key traits. I'm just going to go with them briefly: attentive, attuned, available, affirming, and invested. And each of these is so critical. We were just doing a training on this, and one of the groups said, you know what, if all 4 except for available are in place, available isn't even as important anymore, even though right now that's one of the number one factors of why our workplaces are having such a hard time. So I want to share with you a pilot. I'm going to go through this real quickly. I share this in the book as well, but here you can kind of see. We were just very fortunate to collaborate with the HCA Healthcare Gulf Coast region with their Women's Hospital of Texas. It's the biggest baby hospital in Texas. They deliver over 50,000 babies a year. Just a phenomenal facility. And we dove into this with them. We were solving for keeping their employees. 31% of all newly hired nurses left within a year. The average hospital loses $5 to $9 million on RN turnover. The turnover costing for a staff RN was $46,000. And the average hospital can save $262,000 per year for each percentage point it drops at RN turnover. We also knew that the reasons why nurses were leaving is burnout, staffing shortages, work schedules, injuries, illnesses, violence and aggression, and stress. And it had already been determined ahead of time what managers can do to improve that. First of all, it's improving safety. Secondly, hire more nurses. Those things usually are already underway well within hospital systems today. But the third is this providing support. And in this report, creating an environment in which nurses feel they have the support of their managers and where they can ask for help when they feel overwhelmed or unsure can go a long way to improving working conditions and minimizing turnover. So this is what we really dove into. We started a 27 session discovery workshop series where we actually surveyed people. We went and listened to them, what is going on. We did an anonymous pre-survey to what was happening and getting information. What we found is over 55% of people were struggling with burnout and exhaustion, over half challenged by anxiety and depression. But look at this, 7 in 10 felt unable to be open with others about how they needed support. 2 in 3 felt unable to ask for it. Nearly a quarter didn't feel cared for outside of work. And up to 75% wish they could be more open with others. So that's what we were really tackling. Also, as we know, we have a lot of hybrid workplaces, and even in hospitals, they want flexibility in hours and locations and things. But always, in every single survey, not just with this women's hospital, we have never, ever had anything other than leaders who care and are easy to engage with when needed as not the number one. Every single time, even over flexibility in location, people want leaders that know how to give the support they need. So we asked what their desired culture was. Supportive, look at that, one of the biggest words on there. So this is what we were after. We knew there were time constraints. We knew that employees wanted to be seen. We knew we needed to open up conversations to break the stigma. And we wanted to be able to create a supportive audit that we would make it easy for everyone to know exactly what was available to support each other. We had a 4-phase timeline to go through this with all of our different workshops, our assessments, and things like that. And the total project was over a year. So here's an example of some of the trainings that we did. Everyone dove deep into the book. They took their own personal awkward zone assessment. They learned how to have supportive conversations, and we monitored everything. So how did we look at data? We had our awkward zone assessments. We also did personal care profiles, and we did stop, start, and continue. So the awkward zone assessments helped individuals, but also as an aggregate to see where that chasm was growing. Personal care profiles allowed us to open up conversations of what people really wanted. Do I want to be able to talk about things? Do I not want to be able to talk about things? How can I best have support? And all of these came together for reports for the managers that knew what their teams were struggling with. Again, it was voluntary. Nobody had to say anything. However, on these personal care profiles, we had several people come back and say, can I do it over again? I really want the right thing to go to my boss. I think this can help our relationship. So people are really wanting to open up about what they're challenged with. They want to be able to have these conversations. And with these generational differences, we kind of have to create some frameworks in order to be able to open up those conversations. And that's what we've done. So here is when we talk about the barrier rankings, those mindset rankings, those ones that stay in our head, they were kind of across, they ranked themselves anywhere between a doubter and deflector. Their top barriers, it was just awkward, or it's not my business. They appear okay, so I think they're okay. So all of these, they had a chance to really think through what was stopping them from getting through to people. But when we got to the action barriers, they realized there are a lot of fixers in that group, which obviously is pretty apparent. They're a hospital. Um, but things like, I told them how strong they are, you got this. That's just kind of invalidating. I tried to help them by telling them what helped me. So all of these barriers now became points for them to reevaluate. Maybe that's not working, and teaching them some skills that they could do instead. So there it is. I recognize when others are struggling. Always the number one supportive behavior people say they do well. They spend time supporting others each day. So they're doing a lot of things well. We want to call that out. What do they want in a leader? They want leaders to be approachable, trustworthy, and available. I mean, approachable and available are right up there, going with that core 4 of those 4 issues we're dealing with. Leaders just being so busy. This is another one, a big one that we dive into is, why are people not asking for support? And if you look at the top 3 here, what's so critical is to understand is these are not things that are hard to overcome. Number one, feeling like I need to be strong and handle things myself. How easy is it for an organization to say, hey, you shouldn't be handling things by yourself. I'm here to support you through it. Check. Second one, I don't want to be a burden to others. You know what? You're not a burden to me. It's my job. I'm here to help you through things. Please just don't think you're a burden to me. And feeling like my feelings aren't valid. No, you know what? Your feelings are valid. If every leader just said those three things to everyone they lead and knew how to support a person, so many of our issues in our workplaces would be better today. We also rank them where they feel most equipped to support so we can make sure we give them the right skills they need. But this was based on those support profiles. How do you want to be supported? And some want check-ins, some prefer not to talk about it. And neither of those things are wrong, because the point of being supportive is not prying, it's understanding what exactly someone needs from you. And so these kinds of things open up the conversation, and each leader can kind of see how their employees want to be supported. So at the end of this training evaluation, how important was the training to you out of 119 individuals, or out of 160, some 119 gave it a perfect 10. And how effective was it? Same kind of thing. We had great results from this training. Would you recommend the training? Resounding 162 would recommend it. So really great results. What did they like the best? They loved the empowering engagement, the hands-on nature, the real life scenarios. They built strong connections going through the training. So they had a much more cohesive leadership team after this training. They felt like they were very much equipped with practical tools and resources. We taught them support plans and communication frameworks and filters, and we had the books and a playbook and the awkward zone assessment. They felt that their personal introspection, and their insights and their deeper understanding of people's differences really helped them. But one of the most important things I think is, like, when we do trainings now, some people just think, oh, it's just one more thing I have to do. But what we found is what they said, oh my gosh, this took so much off my plate. I think we underestimate how much of a burden this is on leadership right now when they don't know how to handle these situations, when they don't know what do I personally do, what do I hand off to somebody, what's the framework that I can have a conversation with, all of those things. They felt equipped and confident. So one of the nurse leaders said, I would have saved myself 30 minutes. I worried for 30 minutes yesterday. I knew I had to have a hard conversation with somebody about a terrible situation they were going through, and I didn't know how to handle it. So that was a very big part of this. At the end, this is what's on their monitors. When you understand that the little things are the biggest, actually the biggest, it shows we show up. So really super proud of that. And really what it did is it moved from a transactional type of leadership to a transformational, because they actually could know how to be more supportive and guiding people through their hardships and having the harder conversations. So that's just kind of an example of how we want to create a measurable, scalable, and sustainable framework to be able to bring this support, and connection building within workplaces. So as you saw, we want to be able to measure it. It has to be scalable and it has to be sustainable. So we have two books, Showing Up and Lifting Up. Showing Up is more of a peer-to-peer, and Leadership is a leadership book. We have a certified trainer network that we certify trainers to train this out into the communities. And also, once we go through the initial training with organizations, we will put certified organizational trainers within those organizations or on that college campus, so that this programming can continue to be measured and scaled and supported, and the culture can grow. Here's just some examples of our certified trainers out doing the work, and they're touching just thousands and thousands of lives. It's just amazing to watch. Another picture of some of our amazing certified trainers, and we love to have fun too. We have a summer summit every year. And this is what they can take out. This is what we offer. We have both books, obviously, and we have a whole bunch of signature workshops that are framed out, that go out in this measurable, scalable, sustainable way, along with our certifications, consulting. We do other signature offerings, whether it's crisis response. We have a phenomenal youth program. And we also lay out our training by sector. What I wanted to share with you quickly here is the Lifting Up series, where we kind of brought that into the pilot that I showed you. And really, how we do that is we dive into lifting up. By the way, super excited. The book came out. It's a bestseller in management skills. As of right now, we have 68 ratings at 5 out of 5. So it's really, in the first month, it's done extraordinarily well. Super excited. We break it down. The first part of the book is the case for supportive leadership. Second part is what is the path forward. And the third part of the book is a whole playbook with all these skills. And so when we go out and train this, and when our certified trainers train it, we have a full framework for it. And shout out to Athian and Marie Gill, because we have done a few modules on their Flourishing Bootcamp, also from this book. But here are some of the core skills we train. We train people how to do fast and frequent one-on-ones, how to have capacity and demand conversations, those support profiles we talked about, how to have a repeatable conversation, the supportive conversation, but also as critical as the support-seeking conversation. So we train leaders to know how to have the conversation and then tell them, we're going to train the people that report to you how to seek support from you. So we have those conversation frameworks. We teach people how to do the stay interview. Some organizations do it already. That's great. If they don't, we have a framework for it. We tell people, here are things you should know about each employee. And I just had someone on the phone yesterday that's like, wow, like I didn't really think about that. I think I know my people, but then, gosh, I really don't know my people that well. And so really kind of just helping people understand how they can know their people better and notice them. A communication framework, 2 10s, and obviously navigating the awkward zone. And so we know it works. I think everyone on this call, you're part of the Harvard Flourishing Group. You know why it's needed. I don't need to go into that. We have a whole page of lifting up free resources from the book that is accessed with a QR code from the book. And with that, I just want you all to know that I'm here to support you in any way. I am very passionate, I think, as you can probably see, about this work. My email is here. If you're not linked to me on LinkedIn, please do that. And if you're wanting a book, Kelly, I think you're on here. If you could reactivate the code, because I know when we first launched the first month, we had the get one, give one, but we'll open that up today if you want to do that again. So with that, I'm going to stop my share and we can open it up for questions and thoughts and insights and anything you guys are taking away.
Thank you, Jen. I just wanted to comment on your presentation deck and the power of the images that you've used.
Oh, thank you.
Really is impactful, because language and words, I don't think, really quite capture the essence of what, like, the power of all of this is. So I just wanted to offer that feedback. And there were a number of questions in the chat. So Jeff has his hand up, but hoping that we can touch on, like, the risk of vulnerability in the workplace, and the fear of speaking up and sharing the struggle and potential ramifications or implications of that, because I would imagine that comes up a lot. So, and then there were also a couple questions about trauma in the workplace. But Jeff, why don't you jump in?
Oh, please, the chat questions came first, so please start with those.
Okay, just throw me a question and let's just start that way. But Jeff, like, you're right there. Why don't you go?
Okay.
You
That'll
have
give Karen a little chance
question in
to
there.
tee up the questions one by one.
All right. Well, Jen, I love your presentation, and I'm gonna speak out of both sides of my mouth, because I love what you're working on, your observations, your impact. Clearly, this works, and I've been fortunate to work for some great companies. And as I mentioned in my comment in the chat, I think many companies, if not most companies, are a little overly aspirational in what they communicate, in terms of these are our values and we're a family and X, Y, and Z. And I think the kind of the poster child of that is Google's Project Aristotle, that they promoted the wonders of psychological safety, and then of course had the infamous lockout layoffs, which goes contrary to the psychological safety. And I'm wondering, I have thought that the corollary to all the wonderful work you're doing is to help employees manage their expectations of what's realistic in an employment situation. Because I am incented and rewarded for certain things. And if I do ask for help, it can stick to my brand, and there's negative ramifications even in the best of companies. So I was just wondering about your reaction to that.
Yeah, definitely. I think, the approach that I've taken, and we have the peer-to-peer book showing up, but the approach that I've taken is to equip leaders. And I think that's really where my expertise is, because if leaders aren't going to be equipped to know how to look for these things in the people that they manage, um, it's not going to go anywhere. And it kind of reminds me of the Oxford survey. Like, again, it shouldn't be on the employees to deal with this. It should be up to the company and the leaders to create this supportive environment and be skilled to know how to help that employee and not put it on the employee themselves. Does that make sense?
That's helpful. Thank you.
Des, do you want to ask your question?
Oh, I'm way at the bottom, but
Well,
I'm
I
happy.
think I think your question is going to end up perhaps leading us into some of the other questions.
All right, very good. Thank you. Good morning. Thank you for calling on me. So I'm really interested, Jen, first of all, fantastic job. Somewhere in the comments I said, we need this exact thing now more than ever. Um, but I'm really interested what you found to be the biggest obstacle to deliver this work to organizations.
Awareness and time. I think
Time, yeah.
you all have gone through this presentation, so you heard it. I think helping people understand why the old school leader approach doesn't work anymore takes time. And it's both an awareness issue. I kind of feel like we're on the front end of the curve. I know this work will far outlast me. I mean, it's just, I know this is work that will need it long past me, which is why I'm so passionate about creating the train the trainer model and making sure this is something that can grow well beyond me. I think it is kind of still the front end of the curve. I think right now, even with all technology, it still is a very hyper efficient based culture. And people still sometimes look at this as soft training. Carson, I see you on here. You understand this well as well. Um, and so I just feel like um, most people don't feel they need it, or don't have the time to understand why they need it. They're not connecting the dots. And that was the whole goal for me to write Lifting Up was, I mean, if you've read the book, it's much more like a white paper. It's just study after study after study. And along with what we found, in order to connect the dots as to why is it what we're feeling isn't translating into the workplace, and what are the barriers and such out there.
Yeah, that makes complete sense to me. And I think some of the things that I've also seen out there is that until it starts to impact an organization financially, which is why I loved the data that you brought forth in the hospital RN's attrition and what is the actual cost, I feel like that is often the inflection point where they actually start listening. And so that, which is why it's so important that we have exactly that kind of data. I love how you laid it out. Thank you.
Thank you so much, Desiree.
Mm.
So there were some questions about trauma, Jen, in the workplace. And I mean, ideally, we would want to get this kind of training and information to people as a preventative measure rather than in a response to a crisis. So how often are you called in, like in response to, for example, when there's a suicide in the workplace,
Mhm.
versus people, organizations bringing you in as like a proactive psychoeducational channel?
Yeah, that's a great question. And I think, so much of this work, the work that the research studies that I've done have been funded by New York Mental Health through their suicide prevention efforts, because they do want this to go upstream. A lot of our organizations today, they'll say, well, I'm dealing with mental health because we have mental health first aid, or we have this or that. And in reality, what we should be doing is making sure the crisis doesn't happen in the first place. So I'm super passionate about going upstream. That being said, with my 5 years of suicide, or not suicide, with crisis response, I think everything that is trained in this framework is trauma informed, because it is understanding how you respond to someone in hardship and understanding that barbell, whether you're a leader or a friend. You're not the clinician here. You're not doing the self-care for them, but how do you just be that person next to them every day that maybe is in the cubicle next to them, or maybe is the neighbor next door, or maybe is the best friend? And what do I do? Like, that's really the awkward zone. And I think whether it's in crisis or invisible struggles in the workplace, that's those are the human skills, breaking through that awkwardness and having confidence of knowing, this person's going through either an immediate crisis or not. I mean, in showing up, we have the framework of the cycle of support, and right away is not always the right way. If someone is in crisis, you maybe want them to know you're thinking of them, but it's going to be in those many, 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 many actions over all the years ahead that are really going to strengthen that relationship. So it's trauma informed in that respect. Karen, does that make sense?
Yes. And this all sounds a lot like accompaniment, which is just
Mm,
removing the who's in authority, who's an expert, who's not, but just walking alongside one another and being present.
mm.
That power of human connection.
Yeah, very much so.
Have to have all the answers.
Yeah.
Marie,
Hey there. Thank you for this, Jen. I always feel so elated when I'm thinking about how to start my day and what impact I can help deliver. One of the things I want to maybe point out is as we're thinking about companies and how they are or not uh, supporting this work that you're doing, I think the biggest challenge that we see, and you kind of indicated this too, is that children and the school systems are promoting people to pass tests and to keep moving forward, but we're not spending time on those human skills and those interactive, interpersonal areas. And we're not teaching children or showing children how to be empathetic, supportive, and working through their own versions of the awkward zone. And so, as we think about those kids coming out of high school and coming out of college and entering the workforce that has this, broad structure that is not relating to the human side of how we should be working. It's just this compounding effort. And so as I think about the work you're doing and so many people on this call, I think we have to be thinking about our impact and influence in the workforce for sure, because this is the flourishing at work community. But, it starts before we see people getting into the workplace.
Mhm.
And what is our reflection of work on our communities? Because so much of what you teach too is not only do you get the work at the company and learn how to engage with each other as peers and colleagues, but you walk out the door and you can be a better mom, you can be a better sister, you can be a better friend. And I think that it has just that is the definition of flourishing, that if we are supporting ourselves on flourishing, we can support so many others. So I just wanted to say thank you for this work. I think these are tools and skills that we need to have for ourselves so that we can not only help those that we work with, but for the next generation and reflect on who we want them to be.
Yeah. No, absolutely. Everything you said, and I think that is always a takeaway from our training, because you can't separate work and life anymore. It's impossible. And so, being a leader is much like being a parent, even though the old school leader wasn't, right? The old school leader was just a task driver. Even a professor was just a knowledge provider. And now I think we're finding that it's just all different, and these skills are needed. And especially as AI comes on the scene and we use machines for a lot of things that humans are doing right now, this is where humans are going to need to band together. And in order to be collaborative and innovative together, we've got to break through some of those crazy social inadequacies we have. I see Holly Reisman here is a psychology professor, and she was a certified trainer, and she will talk about this last year. It's almost like it's getting worse in colleges. Like, you get a group of students and ask them to collaborate together, and they literally just stare at each other. And Holly was sharing with me how she's had to tell them, okay, here's how you're going to have your breakout. Please, number one, say your name, like literally, like step by step. And I think we have to account for these social inadequacies, and a lot of times that will be at home, but it is getting down to the youth programs. I was had a great conversation yesterday with the school principal that is wanting to equip his students. And so a lot of our certified trainers work with our youth program, which really is meant for grades three and up, once someone is able to communicate. And so, yeah, it needs to be tackled on all ends, and especially our younger generation. We put the screens in their hands. It's not their fault. They didn't ask for it. If you read some of the things by this amazing Gen Z writer named Freya India, um, she will say, she talks on behalf of Gen Z, she goes, the older generations, they mourn things that they experienced that have gone away. We're mourning things we never got to experience. Like, a lot of Gen Zs will actually go and watch videos of what it was like to be a student in the 90s. Like, what did you do when you didn't have a phone in your hand? And they watch it and they mourn it. They're like, we never got that. And so I just think as leaders and adults, it's up to us to leave this world a better place. And we kind of need some catch up work on the human skills of people that we didn't know. I did it. I had three daughters. I gave them phones. I mean, my book focuses on my youngest daughter. I put a phone in her hand thinking it was the coolest thing. And it led to that book ultimately.
I love that. Yeah, we have to meet people where they are. So if we need to get that prescriptive, then I guess that's where we need to start.
Yeah.
A lot of great comments in the chat too, but just even though we're busy, there's a difference between asking how are you and how are you really. We can all take a little extra minute to have that impact. I always say this costs us $0. Lucas, one of the skills I teach my students and leaders is to use this two-part combo starter to be empathic, but in a safe way. How are you today? Wait, then follow up what makes you blank today. So just like that second level interest in communication.
Yeah, real quick, I can talk to some of these. Jeff Jacobs, yeah, the Texas hospital was post-COVID, which was part of the struggles that they were having, obviously. Ronki, the type of support do the leaders receive after these assessments and, impacting their leadership? One of the things that we like to do with the senior leadership team is to remind them that there is no hierarchy to care and support, that they should be there for each other, and really make sure that they're able to do that and build into their regular cadence of meetings as to how they're going to check in on each other and make sure that any situation that someone's not feeling supported gets resolved. So it's all built into that framework, I think. What can a workplace do when an employee has trauma triggers despite psychological safety? I think a leader would recognize that that might be something that they should have a therapist for, or understand exactly if there are things in leadership that could be altered to help them. I think that would be a combination of a mental health expert and the leader working together to come up with a plan in the supportive conversation framework that we have. Is there anything else you're seeing, Karen?
Well, let's say this. If anyone else has a question, why don't you raise your hand in case your
Got
question
1 minute left.
got buried in the chat.
All right, well, I think then that's it. I just want you all to have my email if there's anything I can do to support you in any way. Would love to hear from you and collaborate with you in any way possible to grow this work. Appreciate your
Thank you,
time.
Jen. Thank you so much. And I'm going to consider this a challenge to think about, like, what can I commit to today to inform how I'm showing up for people that I come across. So thanks for that.
All right. Thank you all. Bye-bye.
Bye.